Over to you, Claire.
Thank you. So good afternoon, everyone. I'd like to welcome you all to the webinar to introduce the new Quality and Improvement Outcomes Framework for NHS-funded library and knowledge services. The webinar is being presented by members of the team who have been involved in developing this outcomes framework. So I'm Claire Edwards. I'm the Deputy Head of Library and Knowledge Services and Technology Enhanced Learning across the Midlands and East. I'm also the lead for the Knowledge for Healthcare Quality and Impact Working Group that has led this development. I'll now hand over to my colleagues also presenting today to introduce themselves. So, Dom.
Good afternoon, I'm Dominic Gilroy, representing the North.
And Lucy.
Hi everyone, I'm Lucy Reed and I'm here representing London, Kent, Surrey and Sussex.
So the main objectives of the sessions today, we're just going to go on to that now. Thanks, Sue. So the main objective of the session today is to provide an introduction to the outcomes framework. I'm hoping that everyone has received a copy of the preliminary outcomes framework that was issued on Monday. So the objectives for today's session are to provide an introduction and overview of the Quality and Improvement Outcomes Framework, to provide an outline of the self-evaluation and validation process for the baseline, and to discuss the support in place. I'd like to emphasise that in today's session we will not be going into detail about each of the outcomes. We will be covering each of the outcomes in future webinars, and we will discuss this later when we talk about the support and resources available. So first question is, can you please confirm if these objectives cover your expectations for the session today? If you can select the green tick for yes and select the red cross for no. Great. If there is anything else that you would like to know about or you have any other expectations, then please do send a comment using the chat facility. As Sue said, we may not have time to cover these suggestions and questions today, but we will take them away and look to address them. So, in this first section of the webinar, we will explore the strategic context and background in which the Quality and Improvement Outcomes Framework was developed. You'll see listed on the slide some of the drivers that have influenced our direction and decisions in compiling the Outcomes Framework. Knowledge for Healthcare has its emphasis on the need for NHS-funded library and knowledge services to be business critical to NHS organisations, providing services around mobilising evidence and organisational knowledge at all levels, from patient care to management, board to bedside. HE's Library and Knowledge Service Policy is quoted at the top of this slide. The policy reminds readers of the need for healthcare to be evidence-based and the importance of access to library knowledge professionals to facilitate this. The long-term plan sets out the vision for the future of the NHS, while the Topol Review tries to identify how to prepare the healthcare workforce for the digital future. Library knowledge specialists have an important role in both these contexts. HEE has a quality framework with a very specific standard for library and knowledge services. That is, that the learning environment provides suitable education facilities for both learners and educators, including space, IT facilities, and access to a quality-assured library and knowledge service. The Quality and Improvement Outcomes Framework will be integral to HEE quality process demonstrating delivery against this standard. To align with the HE quality framework, all NHS organisations that have a learning and development agreement in place will be required to complete a self-evaluation of the outcomes framework. The outcomes framework delivers on HE's knowledge of healthcare commitment to refresh the library and quality assurance framework to ensure it continues to drive service improvement and is aligned with the wider education and service monitoring processes. The subsequent review and development of the outcomes has moved quality assurance away from process, standards and compliancy that underpinned LQAF to an outcomes-based approach. This emphasis will ensure a concentration on improvement, development and delivery of service outcomes. To ensure that the outcomes framework is fit for purpose, a quality improvement approach, Plan, Do, Study, Act, has been used for the development. The framework with development was informed by current thinking and robust research on impact evaluation methodologies. The outcomes framework has also been based on the findings and learnings from the pilot of the quality improvement standards that was carried out in 2018. There have been many groups involved in the development of the outcomes framework. We mention them here to highlight the rigour of the development process. So this includes the HEE Knowledge of Healthcare Board. The board have had final oversight and approved the framework on behalf of Health Education England. The Quality and Impact Working Group. This group provided an additional perspective throughout the development process, asking difficult but important questions of the team. The Quality Task and Finish Group, consisting mainly of library managers from across the country. The group undertook the initial groundwork on developing the new process, including consulting with stakeholders. HE regional leads provided ongoing advice and support, ensuring that the strategic perspective and view of senior stakeholders was taken into account. The HE Quality and Improvement Project Group, consisting largely of the group on this webinar, undertook the work in the final development, piloting and revision of the outcomes framework, and will also lead on the launch and the future training opportunities. Sharon Markless of King's College London, a world-renowned researcher on the evaluation of the effectiveness and impact of library services, provided advice and input into the initial development of the outcomes. And Alison Brettle of Salford University has provided a consistent support and advice to many areas of quality and impact work stream, provided advice and assistance with developing the framework. The HE National Quality Team have provided assurance around the development of the outcomes framework to ensure alignment to the wider HE quality framework. We had 12 sites across the country that were involved in the pilot. This included a range of different trusts and also 2 higher education library services providing to the NHS. There was a range of methods that we used during the pilot. There was the evidence collection and survey feedback from the pilot group. There was the assessment of the evidence submitted. And we also carried out a retrospect to gather the learning from the pilot stage of the project. Overall, the pilots welcomed the new approach and focus on outcomes and service improvement. We did, however, take the key learning from the pilot and applied this to the development of the outcomes framework. We've worked to avoid duplication and repetition in the outcomes. This has been some of the key feedback in the pilots and from the quality improvement standards. We recognise that generic levels of service improvement were open to misinterpretation, so now the levels have been defined for each outcome. Scope for each of the outcomes has been included, and to support the outcomes approach, we have now expressed the evidence requirements of outcomes rather than processes. The Outcomes Framework has currently been issued to you in preliminary format. The Outcomes Framework has been approved by the Knowledge of Healthcare Board and is going to the HE Executive for information on the 15th of May. We are now currently working with HE Communications on the design and publishing of the document. HE Communications are also working with us to support the launch of the framework. And as part of the launch, communication will be sent from HEE, Patrick Mitchell, who's the Director of Innovation and Transformation, to all NHS Trust Chief Executives. The launch will also be supported with wider stakeholder communication through social media and HE newsletters. We are finalising this, but we are anticipating a formal launch in June. So we just wanted to check that everyone has seen a copy of the preliminary outcomes framework. If you have seen it, can you use the hand symbol to show that you've seen that, or ticks? Great. I notice there's one or two that haven't, so we will ensure that this is circulated to people afterwards. The framework was issued on the new national mailing list. So if your service isn't signed up to that, you may want to ensure that you have signed up.
Okay, we'll now move on to take a closer look at the Quality and Improvement Outcomes Framework. So you'll notice in Patrick's foreword that he mentions improving service delivery for patients. And this is surely the ultimate aim of all our work in healthcare. Through the services we provide to whomever we provide them, the end outcome, however far down the line it is, should always be improved services for patients. As we've already mentioned in this webinar, the focus of the new framework is on outcomes and service improvement. The outcomes framework has two main roles. For library and knowledge services themselves, it provides a tool for driving service improvement and monitoring user satisfaction. For NHS organisations, it provides quality assurance that their library service, or the library service they commission or procure, is continually developing and improving to meet their needs. It also challenges the organisation to consider whether they are making the most of the services available from library and knowledge specialists. The overarching aim of the outcomes is that NHS organisations and the healthcare workforce deliver an evidence-based national health service by accessing high-quality, customer-focused knowledge and evidence services enabled by the expertise of healthcare library and knowledge specialists. The outcomes themselves are shown here on the slide. Outcome 1. All NHS organisations enable their workforce to freely access proactive library and knowledge services that meet organisational priorities within the framework of knowledge for healthcare. Outcome 2. All NHS decision-making is underpinned by high-quality evidence and knowledge mobilised by skilled library and knowledge specialists. Outcome 3. Library and knowledge specialists identify the knowledge and evidence needs of the workforce in order to deliver effective and proactive services. Outcome 4. All NHS organisations receive library and knowledge services provided by teams with the right skill mix to deliver on organisational and knowledge for healthcare priorities. Outcome 5. Library and knowledge specialists improve the quality of library and knowledge services using evidence from research, innovation and good practice. And outcome 6. Library and knowledge specialists demonstrate that their services make a positive impact on healthcare. You will notice that some of these outcomes, for example outcome 5, are largely the remit of the library and knowledge staff. while others require ongoing interaction between the organisation and its library knowledge service. For example, Outcome 2. This reflects the fact that the outcomes framework is something which belongs to the organisation and is not solely the remit of the library knowledge service. It can be used to develop and improve the organisation's approach to and use of library knowledge specialists in addition to its use within and by the library knowledge service itself. We'll now start to look at the structure of the outcomes framework itself. For each outcome, the framework offers a spectrum of 5 levels, ranging from level 0, not developed, on the left, up to level 4 on the right, which suggests a highly developed services available for the organisation's staff. Each outcome is also supported by a scope, key questions, an overview of why the outcome is important, together with outcome-based evidence examples.
Within each level, there are a series of indicators which suggest whether the level has been met. If all indicators within a level have been met and can be evidenced, this suggests that the organisation and its library and knowledge service has achieved that level and may be working at the next level. However, if only some of the indicators within a level appear to have been met, then the low, medium, high sub-levels may be considered to provide a further way of tracking progress. We're now going to give an overview of each of the outcomes. So Outcome 1 covers the strategic development of the Library and Knowledge Service, where its staff proactively deliver the priorities of both the organisation and knowledge for healthcare. It includes how library and knowledge specialists create strategic plans with deliverable and evaluated outcomes, engage and consult with senior stakeholders to identify, review and evaluate library and knowledge service developments, routinely use performance monitoring and evaluation processes. It also shows the extent to which the organisation recognises the business critical role of the library and knowledge specialist. Outcome 2 covers the role of library knowledge specialists in facilitating the mobilisation of evidence and internally generated knowledge to underpin decision-making, innovation and change. It shows how the board and organisations use the expertise of library knowledge specialists to work with teams, senior stakeholders and the board to implement evaluated and effective approaches to knowledge mobilisation. It also measures the extent to which the organisation recognises the business critical role library knowledge specialists have in facilitating the mobilisation of evidence and internally generated knowledge.
Outcome 3 highlights how library and knowledge specialists deliver proactive stakeholder and user-focused library and knowledge services. It's worth noting that when we say library and knowledge specialists here, we mean everyone who works in the library, whatever their role, and it recognises that all members of the team play a part in delivering tailored services. The outcome covers a range of things that you might do to make sure that your service meets the needs of different user groups you serve. This might include showing how you analyse the market for your services that you need to provide for existing and potential users, the feedback that you get as you engage and consult with your stakeholders, how you promote services to targeted groups of existing and potential users, how you enable users to access high quality evidence at the point of need and in appropriate formats, and the way you work collaboratively to extend the reach and spread of your services. Outcome 4 covers the requirements there are to be the requirements for there to be sufficient library and knowledge staff with the appropriate experience and skill mix to deliver an evolving service. This outcome includes working in partnership with colleagues from other library and knowledge services where that's indicated. So in responding to this outcome, you might consider whether you see any gaps that you can address by training, buddying, or CPD, whether gaps in your team can be addressed by role redesign, or any gaps that might be addressed by collaborating with others. And this is a real strength of our sector.
Outcome 5 is about the evidence base. In the same way that we encourage colleagues in other areas of healthcare to be evidence-based, we too as library and knowledge professionals need to use evidence in our own work. And this outcome is about showing that evidence-based practice is integral to the planning, design and delivery of our activities. In thinking about this outcome, we may wish to consider times that we have adopted or adapted innovation and good practice, when we've reviewed the effectiveness of our services, when we've shown optimised investment, and when we've tested for cost effectiveness. Outcome 6 will hopefully be very familiar to everyone. It covers the effectiveness of library and knowledge specialists in collecting evidence to show the impact of services and how that evidence is used to promote the service both internally and externally to stakeholders. Impact is defined as the difference or change in an individual or group resulting from contact with library services. We do have some really good examples in the Impact Case Studies database and some vignettes created which can be used in your library, in presentations, in reports or on social media. So, having seen a little bit about the outcomes and perhaps reflecting on the document if you've had a chance to do that when it was circulated earlier, we have another question now for you. Do they sort of make sense to you in general? Are they kind of the things you expected? Is there anything missing or any of them seem a little bit unusual or strange to you? So we're looking again for a tick or a cross or a hand raise in terms of a tick or a hand raise for positive and a cross if you have worries or concerns really. So if you could do that now. You might already have a tick or a cross showing from last time, so
we can see somebody's got a really lovely smiley face.
Yeah, that's great.
Fitting with the weather.
So there don't look to be too many concerns there. There's one or two issues. If anyone does have any specific questions or any concerns, if you want to use the chat facility sort of to elaborate on that, then Sue will pick that up at the end and we'll make sure that we feedback and also include whatever concerns, questions you have in our FAQs and guidance, because if you're asking it, then it's likely to be that other people have the same areas of concern.
So now we're going to have a look at how self-evaluation works. Self-evaluation is the first stage of the full assessment process that's shown here in this diagram. As with previous quality assessment processes, the first step is for the organisation to self-evaluate against the outcomes. A date for your diary. This is going to take place between April and May 2020, and we'll be expecting submissions by the 26th of June 2020. All NHS organisations with which HEE holds a learning and development agreement will be asked to carry out a self-evaluation. In order to complete the self-evaluation process, you'll want to work with people from across your team who will bring a different perspective on the processes. It's worth getting your evaluation team together as soon as possible so that you can start mapping out what kinds of evidence you might be capturing for each of the outcomes. Self-evaluation is based on answering 3 general questions. How well are we doing? How do we know that? And what are we going to do now? You'll be asked to think critically about the services you provide and the impact that these services have on your organisation. It's your chance to reflect on your strengths, highlighting and sharing good practice through the evidence you provide. It's also a time to consider areas which would benefit from improvement and draw upon plans for resolving these. The process gives you an opportunity to demonstrate your value to your users and also to evidence the quality of your services to senior stakeholders. So to submit your self-evaluation, you'll be completing one of our ubiquitous forms. So for each outcome, you'll be rating your level and whether you're low, medium and high within that level. So if you're looking at the screen now, this is the first screenshot on the top left of this slide that you can see with the coloured lines. At this point, I should mention that you should be realistic about where you sit on the levels. There's nothing to gain from overstating your level of compliance. And then if you're looking at the screen, the second screenshot on the left-hand side of the slide, for each outcome, you'll need to write a short narrative about why you think you achieved that level. This should reference the evidence that you'll embed in your submission. So we'll pause here to have a quick look at what we might mean by evidence. For starters, everyone's going to be asked to submit their strategy, their annual report, their implementation plan, and also any service level agreements that you might have in place through which you deliver library services to other organisations. And also because the submission that you send us next year is going to be assessed by people who are not necessarily from your region and they don't necessarily know your service, you'll be asked to write what we're calling a pen portrait or an outline of your service. Along with these core pieces of evidence, you'll also need to submit any additional evidence that supports your self-evaluation and the narrative you submit. As you saw earlier when we were looking at the structure of the outcomes framework, for each outcome there are examples of the kinds of evidence we think might be useful, but these are provided just as suggestions rather than instructions. Think about the quality of the evidence you provide as being the important element for this. Evidence should be succinct and strongly support your self-evaluation and narrative. The reflective practice approach used by CILIP Professional Registration, amongst others, may be useful here. So it's important that you address the so what question with your evidence. How do you make a difference to your organisation and what impact do you have? And then again, looking at the slide, on the right-hand side, the snap there, the final part of your submission at this stage is going to be a summary of your key strengths and good practice. These will be woven through the rest of your narrative, but it'd be really useful if you could pull these out for us so that we can help share them back out to the whole network. So that's an awful lot to take on. The question at this point, and one that you might want to answer within the chat function, is thinking about how you're going to prepare for this self-evaluation. Who might you pull into your evaluation team?
Could I just ask the presenters, can you just make sure your sound is at the highest level? There are a few people who have had a few issues hearing us, but in the main everything seems to be okay now. Thank you. Sorry, you may wish to repeat that again, Lucy.
So the question was, so if you're thinking about putting together a team that would help with the self-evaluation, who might you invite onto your team?
And are we going to ask people to put up their hand because they want to speak, or are we going to ask them to send something through the chat?
I asked to send something through the chat. Sorry if that wasn't caught.
No, that's fine.
I appear to be sitting in a corridor.
Let's have a look then. So we've had a very good suggestion about talking to other library champions in your organisation. Something around speaking to managers, and also the importance of involving your whole team, including paraprofessionals. Some are talking about things that are specifically for them, so as well as the library team, also looking at where they sit within an organisation, who their manager is, but also engaging with education managers and relevant execs. Research and development team, quality improvement leads. There's a whole host of ideas which we will capture. So thank you. Clinical audit. Oh, covered everything, I think. Really good. And importantly, those who stakeholders who, if you're serving more than one organisation where you have an SLA. So thank you for that. That's really good.
Brilliant. Thank you. So the final document in the submission set is an action planning template. So this part of the process answers this what next question. So through your self-evaluation, you'll be reflecting on where your service can be improved and the steps that you might take to take you to the next level on the levels. It's useful for your planning process to be able to capture your thoughts about how you might approach these improvements. But also your senior stakeholders will be reassured that to see your action plan and to do complete this stage. Think mostly about how a quality improvement approach can help you achieve these improvements. And as Sue mentioned just a moment ago, there is some complexity here. So many LDA organisations are served by one dedicated in-house library knowledge service. So for these organisations, a library knowledge service will submit a self-evaluation for their host organisation. If your library provides a service under service level agreements to another LDA organisation, you'll be asked to contribute to that organisation's self-evaluation. You may well be reaching the same levels for this external organisation as you do for your host organisation, but it is an opportunity to consider whether your reach and the impact of your services is identical across all the organisations you serve. You will need to provide evidence which refers to all the organisations you serve in your submissions. In some geographies, multiple library services collaborate to support one LDA organisation, so often a community service or a mental health trust with a large geography. The best way to contribute to the self-evaluation in this case might be by bringing together an evaluation team from across different services to produce a collaborative return. If you have any concerns about how this might work for you, then use the chat function here or email your regional contact and we'll follow up with you after the webinar. So email addresses will be given right at the end of the webinar so that you can contact us and discuss any concerns you might have about this.
So we'll now look at the process and the timelines for the baseline validation. So baseline validation will be carried out between July and December 2020. This is a new process and we need to ensure that the baseline is correct for everyone to support and enable service improvement. To date, quality assessment processes have been done by HE Regional Library and Knowledge Service teams. This baseline self-evaluation and validation is also our chance to get a truly national perspective on service quality. Validation will therefore be a single national process, as Lucy mentioned earlier. Each return will be reviewed by 2 members of the HE LKS team, one from the region of submission and one from another region. We will be putting a consistency checking and a calibration process in place to ensure equity and consistency across the board. For the baseline validation, we are not including peer reviewing, though we hope to implement this in future years. But to support implementation, we will be opening up an opportunity for some managers to shadow the validation process during September and October 2020. Reports from the baseline validation will be sent back to organisations in November-December 2020. This will include validation of the levels, feedback on good practice and areas for service improvement. We'll also be aiming to represent the validation of levels in a radar chart, as shown as an example on the slide. To align with the HE quality framework, we will be feeding back the outcomes of the validation to the national and regional quality teams.
We'll now move on to look at some of the support that's available during this initial baseline self-evaluation year. So a Quality and Improvement Outcomes Framework page has been prepared on the Knowledge for Healthcare blog, and you can find this under the Quality and Impact menu. Although it's not currently populated, over the next few weeks we will be adding documents to this page. And the resources will include some of the documents that we've already mentioned today in the webinar. So there'll be a copy of the Quality and Improvement Outcomes, a handbook for the baseline self-evaluation process. There'll be a glossary of some of the terms which we use in the documentation. This is to help us make sure that we're understanding terms in the same way when we look at a particular theme or a concept. There'll be a list of frequently asked questions which has been generated through these webinars and from questions posed to the library leads across the country. And then there'll be a self-evaluation report template which you can use to undertake and submit the self-evaluation. There'll be a validated levels report template which HE leads will use to feed back to you on the self-evaluation, so you can see what that will look like. There'll be an improvement planning worksheet which is designed to help you identify and prioritise areas for improvement, and there'll be an action plan to document your actual planned improvements. In addition to the documentation, we'll also be running a series of webinars which focus on the different outcomes and other areas relating to the Quality and Improvement Outcomes Framework. And the key planned dates are shown here on the slide now. So if you wanted to put any of those in your diary, that's a good idea. So on this slide, you've got the contact details for members of the team who have been directly involved in the introduction of the new Quality and Improvement Outcomes Framework. And do feel free to ask questions of your local contact at any point in the process. These contacts will also be on the blog page that I referred to earlier.